Now the next presentation is by Dr. Anasua Kapoor on yellow laser photocoagulation of superficial and deep conjunctival nevi.
Good afternoon, everyone. So I will be presenting a case series on yellow laser photocoagulation of conjunctival nevus, a minimally invasive alternative to surgical excision. So more than 50% of conjunctival tumors are melanocytic tumors, and amongst them around 50% are conjunctival nevus. And conjunctival nevus, the diagnosis is usually clinical, where it is present since birth, usually unilateral, is very well defined in the interpalpebral location, limited to the limbus, has cysts, change in size happens at puberty, and there might be a feeder vessels. Further, we can go ahead and do an AIOCMT3 to look for the cysts there. So in our study, we included clinically diagnosed cases of conjunctival nevus who were stable on size and color both for over the past 6 months, and performed laser photocoagulation with the help of Hitidex yellow laser 577 nanometer. We looked on the follow-up visits, which were on day 1 week, 1 month and 3 months. We looked into the efficacy of the laser, whether the lesion went away with laser or not, and also the safety. The safety we assess with the help of the ocular keratograph, all the ocular surface disease index, the tear meniscus, the non-invasive tear film stability, lipid layer thickness, Shermer, Oxford corneal scoring, everything was looked into. And we also performed histopathology of the lasered conjunctiva wherever possible. So this was the very first patient, because this has never been reported in literature. So the first patient we chose was an anophthalmic socket where there was a deep nevus, and when we applied laser, what we found that initially there was a graying, followed by some cavitation which was developing, and finally it was this blackened lesion which we could easily remove with the help of a cotton bud, and this is at 1 week follow-up, you can see. We also sent the gray and blackened part for histopathology, and what we found out was that the gray part had considerable amount of viable nevus cells, and the percentage of nevus cell came down in the blackened part. This is the result, the 8 patients. This was a pilot study where the 8 patients, you can see that they were moderate to severely pigmented nevus, and we kept the spot size and the duration fixed, and the power we varied from 300 to 600 depending on the amount of pigmentation which was there. And we looked into the residual pigmentation at 3 months follow-up, and as you can see, 3 patients had mild pigmentation at the limbus, which was because we didn't laser the limbus. This was the first study we were doing. Maybe moving forward, we will be lasering the limbus as well. So this is one particular patient. This is at 1 week. You can see the epithelial defect there, and over at 1 week and 1 month, everything normalized. So the laser was 100% effective. By calling it effective, I mean that on applying the laser, the lesion was coming off nicely, but the limbal residual was there for 3 patients because we purposely didn't laser the limbus. There was no recurrence at 4 months follow-up. There was, apart from some congestion on POD1, there were no changes on ocular surface in all the parameters that we studied. So this is a review of literature. There are only 4 studies in literature, majorly from Korea, where you can see majority of them were just superficial lasers. So our study for the first time is done in India, and we have done it on all deeply pigmented nevus. And yellow laser photocoagulation is indeed a safe and effective outpatient procedure based on this pilot study. And there are no complications like scarring, tissue dragging, neovascularization, which usually happens with surgery. So just to summarize, the pros of laser photocoagulation over surgery are, it's just an OPD procedure, ensuring quick recovery, being cheap, can be done just under topical anesthesia. There are no significant side effects. The con being that there was no histopathology confirmation, because majorly whenever we send the histopathology sample, it was charred. So the pathologist couldn't come to a conclusive diagnosis there. So thank you everyone for a patient listening.
So it's very good presentation. in surgical excision, is there any report that they do excision with conjunctival autograft? Any report like that?
Excision of a conjunctival nevus?
Yes, in surgery.
Yeah.
Do they do
so
graft?
the standard of care is excision.
Excision. No
with
grafting?
conjunctival autograft or a amniotic membrane graft. That is depends on the surgeon how you want
So
to
if there is
reconstruct the
autograft,
neurosurface.
then scarring should not be there.
Yeah, but like there can be tissue dragging as we see for CLAGs or AMG. That can be some neovascularization happens.
So is it more cosmetic in appearance than the surgery?
Yes, that's what our preliminary observations are, that it is
Good, thank you.
better to the standard of care surgical excision.
Very nice, Dr. Anasua, very novel. Now, these patients had only one sitting, or did they have multiple sittings?
So two of them, this is the first study, as I said, with yellow laser. So we were not sure of the laser parameters. We were titrating as we were going on. So two patients which were the huge nevuses, more than 4 millimeters on the greatest diameter. So we chose to space it out over a period of 1 week. So out of these 8 patients, 2 patients, we have done it over 2 sittings.
Excellent. I'm sure your patients are very happy with the outcome as well.
Yeah, as of now.
Thank you.
Thank you.